We welcome our viewers around the world to our educational channel. Today's video is about one of the most important development indicators, called the Human Capital Index. In it we explore Nigeria's performance. It is not only alarming, it is a national crisis in motion. This index shows exactly how much of their God-given potential Nigerian children are losing before they even reach adulthood. Please, subscribe, share and like. Visit these trusted global sites to explore the Human Capital Index and compare how nations are investing in their people. Your learning journey starts here. The learning objectives are on your screen. In this video, we break down what the Human Capital Index measures, compare Nigeria with global leaders like the USA and Singapore, examine Nigeria versus Ghana, and highlight the urgent steps needed to strengthen Nigeria's human capital. The Human Capital Index, created by the World Bank, answers a very simple but powerful question: if a child is born in your country today, what percentage of their full potential will they actually achieve by age 18? The index measures three things. Number 1. Survival. Will children live to age 5? Number 2. Education. How many years of schooling will they complete, and how much are they learning? Number 3. Health. Are children well nourished? And are adults healthy enough to work productively? The score ranges from 0 to 1. A score of 1 means a child will reach 100% of their productivity potential. A score of 0.36, like Nigeria's, means a child will grow into an adult who can only achieve 36% of their possible productivity. This index is the foundation of economic growth, innovation, development, and national power. Nigeria's HCI score is 0.36. That means the average Nigerian child will become only 1/3 as productive as they could be if they had good education, proper nutrition, and quality healthcare. Here is the painful comparison using medians. In high-income countries the score is 0.71. In upper-middle-income countries, 0.56. Lower-middle-income countries, 0.48. Low-income countries, 0.37. With a score of 0.36, Nigeria is performing worse than the poorest countries in the world, even though it is officially classified as a lower middle income nation. The Human Capital Index of the United States is 0.7. This means a child born in America today will reach about 70% of their full productive potential by age 18, based on current levels of health, education, learning quality, and survival. It reflects strong early childhood health, high school completion, and excellent learning outcomes, standards that countries like Nigeria must urgently strive toward. Singapore has the highest Human Capital Index in the world, scoring about 0.88. This means a child born in Singapore today will achieve 88% of their full potential, the strongest outcome of any nation. Singapore's success is driven by world-class education, excellent healthcare, low child mortality, strong nutrition, and consistent investment in people. It shows what is possible when a country puts human development first. Let us now focus on the Human Capital Index for Nigeria, the most populous black country in the world. The first component is child survival. In Nigeria, only 88% of children survive to age 5. Poorer countries average 93%. High-income countries are at 99%. In the chart, with the red box, Nigeria is far below the trend line, meaning even for its level of income, child survival is shockingly low. This reflects high infant mortality, high maternal mortality, poor antenatal care, weak health care, lack of emergency services. Nigeria's children spend 10 years in school on average. This doesn't sound terrible until you look at the learning quality. Nigeria's harmonized test score is only 309. Low-income countries score 356. Lower middle-income countries, 392. High-income countries, 487. In the global scatter plot, Nigeria is one of the lowest dots on the entire graph. This means, children sit in classrooms but do not learn mathematics, reading, critical thinking, or problem solving. Poor learning translates directly into low productivity in adulthood. Nigeria cannot compete in the modern economy without fundamental education reform. Next is adult survival from age 15 to 60. In Nigeria it is 66%. In poorer countries it is 75%. It is 80% in lower middle-income countries and 92% in rich countries. What this means is that 1 out of every 3 Nigerians will not live to age 60. Think about that. Let that sink in. 1 out of every 3 Nigerians will not live to age 60 years. This is driven by poor healthcare access. The highest maternal mortality in the world. A high population of adults with hypertension, stroke and cancer. The endemicity of infectious diseases like malaria and tuberculosis. Inadequate emergency response. When adults die early, the workforce becomes weaker, poorer, and less productive. Stunting is one of the strongest indicators of poor nutrition. In Nigeria, 37% of children under age 5 are stunted. That means their brains and bodies did not develop properly due to malnutrition. In poor countries, approximately 35% are not stunted. The data in Nigeria are worse. Overall, stunted children learn less, score lower in school, and less as adults. They are less productive. They have higher disease burden. In the global chart, Nigeria is far below the trend line. A nation where 1/3 of children are stunted cannot compete in the 21st century. Let us look at the overall picture. Across every HCI component, survival, school years, test scores, adult survival, and stunting, the charts show the same pattern. Nigeria is far below where it should be for its level of income. Even when countries have similar GDP per capita, they perform significantly better. This means Nigeria's problem is not just poverty. It is policy failure, governance failure, and an underinvestment in people. Countries grow not because of oil, minerals, or land. They grow because of people. China's rise was built on better education, better health, better nutrition. South Korea rose from poverty to a high-income country in 1 generation because they invested heavily in human capital. Nigeria, Africa's most populous nation, cannot achieve economic transformation if children are not surviving, students are not learning, adults are not living long, and childhood stunting remains widespread. Human capital determines national productivity, competitiveness, innovation, job creation, national security, and long-term economic growth. These are the key reasons Nigeria is falling behind. Nigeria can turn this around, but only with intentional, focused, long-term investment. Strengthen primary healthcare to reduce child and maternal deaths. Provide nutrition support for mothers and children to end stunting. Invest in teacher training, improve the salary of teachers, and the teaching environment. Invest heavily in early childhood education. Improve the pay for doctors, nurses, and healthcare workers. Support technology, vocational skills, and STEM learning. Fight corruption so resources reach the people. Human capital is Nigeria's greatest asset. The future is not oil. The future is people, and Nigeria must protect and invest in them. Here is how Nigeria compares to Ghana. Ghana outperforms Nigeria on every major human capital indicator. More children survive to age 5, they stay in school longer, they learn more, adults live longer, and fewer children are stunted. These differences in survival, education, and nutrition directly shape the future productivity of both countries. When we look at the full human capital index, Ghana scores 0.44 while Nigeria scores 0.36. This means a child born in Ghana will reach 44% of their full potential, compared to just 36% in Nigeria. Ghana is performing roughly at the sub-Saharan African average, while Nigeria underperforms its economic capacity. This gap reflects decades of underinvestment in health, education, and nutrition. Ghana outperforms Nigeria because it invested earlier and more consistently in basic education, child survival, and healthcare coverage. Ghana's children stay in school longer, learn more, and are less likely to die before age 5. Better governance helps Ghana convert more of its national wealth into real human potential. Something Nigeria has failed to do. We are running out of time. Nigeria must invest in its people now, their health, education, and survival before the crisis becomes irreversible. The learning objectives have been met. We hope you enjoyed this video presentation. If you found this presentation informative and educational, please give this video a thumbs up and consider subscribing and sharing with family members, friends, and colleagues. Your support helps us create more informative and educational content. Until next time, stay strong, stay hopeful. This has been a presentation of Opomulero Media LLC.